So even though you have no alcohol in your system, you can be charged with and convicted of a DUI. I call these non-alcohol DUIs, or sometimes they're called drug DUIs. Sometimes you'll see that they're called DRE DUIs, and we'll talk about that in a moment. But what that means is, if you are intoxicated on illegal drugs or even prescription medications, you can be charged with a DUI. Here is one thing that most of my clients think is somewhat unfair, is that even if you are taking medications just as prescribed by a doctor, they're prescribed and you're taking exactly the quantity on the label, you can still be charged with a DUI and still be convicted. The fact that it's prescription and you're following doctor's orders isn't a defense. So the question is really, what to do if you've been charged with a non-alcohol DUI. If you've been charged with a non-alcohol DUI, there's a couple things that happen that make your DUI stop a little different. The first is, DUIs in the state of Idaho are kind of set up to be prosecuted based on alcohol. So they'll give you a breath test and it comes back over the limit, then they know what to do with that. Oftentimes it will come back and it will be below the legal limit, or it'll be a 0.00. At that point, what should happen and must happen if you're going to be prosecuted is that a specially trained officer will have to get involved, and he's called a DRE, a drug recognition examiner, or an expert. And this person is going to do a whole battery of like 13 to 15 different tests, and those will include taking your pulse, taking your temperature. They even do a skin elasticity test where they kind of pull your skin, and all this is an effort to determine what is causing whatever the impairment the officer is seeing. In addition to the DRE, this evaluation by the specialized officer, they're going to take a blood draw or a urine draw. Now, frankly, urine draws are just really not reliable. So typically the officers will request a blood draw, and that blood draw will be sent for testing. That test result will come back and it will demonstrate, or it will have a printout of what medications or illegal substances were tested in your blood. So it might come back and say, hey, there was some aspirin in there. It might say, hey, there was THC from marijuana. It just depends. And if it comes back listing drugs in your system, then you will be kind of charged with, and the case will proceed. If it comes back and there's no drugs in your system, the case will be dropped. So here's kind of how it works. This is the classic shoot first, ask questions later. They'll arrest you. They will proceed with the case without the breath test results. And they'll just kind of go on the assumption that you're going to fail the blood test, and then wait until the blood test comes, and then they may dismiss if they need to, but other than that, they'll keep pushing forward.